the #1 killer of women is actually cardiovascular disease. So this also includes breast cancer and all cancers. Cardiovascular disease is often underdiagnosed, mistreated, and this is why this statistic is increasingly high. Women need to understand that their heart attack looks entirely different from men. As long as they understand that they may have something that is abnormal in this region, plus an additional qualifier that they don't normally feel, they know their body, they should seek medical attention. In addition, women also have different types of heart attacks. So most men, their heart attacks is created by a blood clot, for example. This blood clot creates a blockage that reduces blood flow. The heart, which is a muscle, doesn't get the blood flow. It gets injured and could eventually die. Women, completely different. Their blockages could be in vessels or arteries so small we can't even see them. So they may get a kind of diagnostic test, for example, a catheterization, and they may be told everything is fine with your arteries. Or women may have a dissection, which means a tear of one of their arteries. And this may also not be caught with standard diagnostic imaging. So the biggest thing that women need to know is what are their risk factors so that they can pay attention to their body's signals or alarming signs when they feel different. So traditional risk factors we all know about: smoking, family history, lack of exercise, diabetes. But women-specific risk factors should be really taken into consideration. What is that? So that means if you yourself have chronic inflammation, so think inflammatory diseases, rheumatoid arthritis, lupus are some of them, that's an increased risk factor. Or if you have had a history of preeclampsia or eclampsia or gestational diabetes, that's another alternative form of inflammation. In addition, if you have a family history, if that family history has had someone where they've had a cardiovascular event before the age of 65 in women, that's too young. So paying attention to those things really can help you seek medical attention. So the biggest thing is going to be optimizing your risk factors. So for example, if we know you have diseases of the small blood vessels, those traditionally do not do well with stents or surgeries. Those traditionally do well with modification of your lifestyle plus medications. So it's a combination of Eastern and Western medicine. Making sure you're reducing your stress levels, easier said than done, but optimizing your sleep, making sure you're getting restorative sleep. Just because it's 6 hours doesn't mean that you got deep sleep and REM sleep. Also making sure that you are optimizing other things into your diet. A diet focused into very plant-based, unprocessed diet is super important. And then we have our standard Western medications, right? So statins, aspirins, and additional other medical directed therapy may be appropriate for you. It is never too early to see a cardiologist. Something that women should be aware of is that pregnancy itself can unmask heart disease. So if you have a history of preeclampsia, you already have more than a twofold risk of developing coronary artery disease or blockages compared to the standard population. Also, hormones play an important role. As we enter the menopause age, which is around the age of 51 to 52 years old for a standard American, you have a change in your estrogen levels. That estrogen was thought of to be as protective, now has dropped, and so you may be more at risk to developing plaque or blockages and rupture of those things. The best approach is not a one-size-fits-all. It's looking at the patient in front of you, incorporating the risk factors, and then get a, what I call, thumbprint of your heart. We have every kind of subspecialty, whether you have an electrical problem, whether you have a plumbing problem, whether you may not have a problem and you want to be preventative and you want to live the most long but also functional lifespan. We offer it all.